All right, today we're going to take a look at this video titled "Hospitals Are Overwhelmed as Coronavirus Cases Surpass 10 or 100,000 in the U.S." This is posted on March 28th, 2020. Let's get into it.
But we want to begin right now with the latest headlines. The number of cases in the U.S. jumped again overnight to at least 102,000.
So here's a graph we're being given today, March 28, 2020, saying at this point, the total U.S. cases are at 102,074, and total deaths, 1,605. So you can do the calculations on that to find out what the percent is. Look at the rise from about the March 7th period to March 27th. In the last days, we've seen significant, or it's been reported that there's a significant growth at place here. And you can see how at the end of the chart coming up in these last few past days, it's grown more and more exponentially. So that's the premise being set. Let's continue into it.
With 1,600 deaths now, the U.S. now has more reported cases than any other country in the world. Nearly 45,000 of those cases are in New York State.
And some good news for the tens of millions struggling because of coronavirus. Those relief checks from the federal government could be in your hands in just 3 weeks. President Trump signing a $2 trillion relief bill on Friday. And some states are resorting to more drastic measures to stop the spread. In Rhode Island, police are stopping drivers with New York plates, telling them to quarantine themselves. And Florida's...
Wow. So they said in New York, right? Let's go back and listen to that one more time. Make sure we get it right.
$1 trillion relief bill on Friday, and some states are resorting to more drastic measures to stop the spread. In Rhode Island, police are stopping drivers with New York plates, telling them to quarantine themselves.
And wow, so in Rhode Island, if you have New York plates, they will stop you and they'll tell you that you need to quarantine yourself simply for having New York plates. Okay?
Florida's governor is telling people coming to the state from coronavirus hotspots, they need to self-quarantine as well.
Our team is covering the story across the country and around the globe this morning. We want to begin with NBC's Aaron McLaughlin in Los Angeles.
This morning, across the country, over 100,000 cases, more than 1,500 dead, and an all-out war against COVID-19.
We go out there today and we kick coronavirus ass.
Okay.
State of New York.
That's the governor of New York, Andrew Cuomo, quickly becoming the poster boy for the response to what they want people, the reaction they want from people during the coronavirus spread.
Now with the grim distinction of being the epicenter of the crisis in the United States. Friday, the death toll surged from 385 to more than 500. Among the lives lost, Mount Sinai nurse Caius Kelly.
He just had this infectious energy. You felt good when he was around.
Friday night, all across the city, a show of appreciation for those on the front lines. As doctors continue to warn, the system's overwhelmed.
It's like a war zone. We're in a war with very limited resources.
And a scramble to build...
Another thing I want to bring up, why is it keep being mentioned that this is akin to a war? They're saying we're in a war zone. It's, in my opinion, it's to promote fear, because war promotes fear. And then that fear can be turned into actions that some may have an interest in taking. So just pay attention to the rhetoric and the terminology that you're
makeshift
hearing.
Morgues and field hospitals. New York Governor Andrew Cuomo to NBC's Lester Holt.
I hope this whole facility, Lester, stays empty. And we built it for nothing.
But you don't believe that's going to be the case?
The numbers don't say that's going to be the case.
In California, it's all hands on deck.
Every minute is a minute lost.
A dire warning from officials. Los Angeles is just days away from the kind of crisis engulfing New York. This weekend, the USNS Mercy is expected to open, providing much-needed support to non-COVID-19 patients. As impressive as this ship is, it represents only a fraction of the city's needs. It has 80 ICU beds. LA officials estimate they need 3,000. New
I think
Orleans,
it's also
too, emerging
important
as
to
a
mention that although New York and Los Angeles both have shutdowns, stay-at-home orders in place, they're still having some of the highest rates of coronavirus being reported and deaths in the U.S. Now, granted, they are larger cities, but I think it should show that just because you're putting a stay-in-place order in effect doesn't mean that it's going to automatically decline the rates of cases.
hotspot in the pandemic. NBC's Blaine Alexander.
Now, with the cases here in Louisiana growing faster than anywhere else in the world, the reality is that there are just not enough tests to confirm every case.
In Miami, a mandatory curfew. Orders to stay off the streets from 10 p.m. to 5 a.m.
It is growing quickly. I mean, every time I go into work, we have at least a few more cases.
Now there's a statewide ban on vacation rentals, in addition to a mandatory 2-week quarantine for anyone arriving from Louisiana and New York. In Rhode Island, police stopping cars with New York.
Because that's another mandatory quarantine.
It's a statewide ban on vacation rentals, in addition to a mandatory 2-week quarantine for anyone arriving from Louisiana and New York.
Wow. So anyone that comes into the state from Louisiana or New York gets a mandatory 2-week quarantine, and they're also shutting down all vacation rentals.
Island, police stopping cars with New York plates.
Right now, we have a pinpointed risk that we need to address, and we need to be very serious. And that risk is called New York City.
That was NBC's Aaron McLaughlin reporting.
And also this morning, hospitals across the country should hopefully be getting more ventilators after President Trump, under pressure, officially invoked a little-used power of the presidency to get a major automaker to pitch in. But that automaker says they were already on it. NBC's Kelly O'Donnell is at the White House with the very latest on that. Kelly, good morning to you.
Good morning, Kristen. Despite the president's reluctance early on, he is now using the federal government's power to manufacture more ventilators and buy more where available over the next 3 months. A tight timeline, given the number of serious illnesses from coronavirus continues to rise in hotspots around the country. President Trump moved from talk to action on forced manufacturing of medical equipment.
The ventilator is a big deal.
After 9 days of discussing the Defense Production Act powers, Friday, the president finally used it when he says negotiations with General Motors.
So Trump finally put in place what's considered the Defense Production Act, which I guess allows him to utilize the services of large manufacturers to help with emergency operations, which is what the coronavirus spread is being classified as. But although that may be a rather harmless act, it's important to pay attention to the different bills, laws, acts that are being put in place at this time, especially during states of emergency, because that's when a lot of acts that we otherwise would never allow to pass all of a sudden get passed because everyone's in fear.
To build ventilators hit a roadblock.
We didn't want to play games. If they don't treat you right, I don't call.
In a remarkable turnaround, the president, who had insisted last week the federal government is not the nation's shipping clerk.
We have to get these people on board. We're not looking to get into a big deal on price.
Now says the U.S. government can order ventilators to supply states and allies.
If we do not need them, that would be wonderful. We can help a lot of great people all over the world. We can help them live.
Bristling at demands and complaints from some governors, Mr. Trump made known his expectations.
I want them to be appreciative.
As the virus spreads and deaths climb, the president backed off his push to ease restrictions by Easter Sunday, saying he will consult medical experts.
Okay.
Life.
And I think I mentioned this in a previous video that don't ever believe what comes out of Trump's mouth, okay? Because he'll say one thing and then a week later he's doing something completely different. He's a smokescreen. He says one thing, but the action that was always going to take place from those who wanted the action to take place It's going to happen, and he's going to be the one who is going to basically be the face of that action. But understand that these orders are above Trump. Okay? This isn't a political thing. This is a world government system, a world system of control. And they are pulling the strings in the directions they want them to go. Don't fall for the rhetoric.
Then it's your safety. And if we need more time, they're not going to have a problem waiting it out.
The president was surrounded by Republican leaders as he signed the largest relief package in U.S. history. Democrats were not invited to attend.
I want to thank Republicans and Democrats.
Today, President Trump heads to Norfolk, Virginia to send off a Navy hospital ship. NBC's Courtney Cubie.
The next time the USNS Comfort is scheduled to be in port is in New York City. The 1,000 beds on this hospital ship will ease some of the burden on New York City's overwhelmed hospital system.
It sends a signal when the president is able to go there and say thank you.
And President Trump will return to the White House after his visit, saying he'll be very careful not to shake hands while in Norfolk. And General Motors is saying that it is working around the clock tirelessly and had been already agreeing to do this work when the president invoked the Defense Production Act. They hope to have in their Kokomo, Indiana production facility 10,000 ventilators made each month. Kristen?
A lot of hospitals eager to see that equipment soon. Kelly O'Donnell, thank you from the White House. Meantime, there is some hopeful news this morning in the fight against the coronavirus. The FDA has approved a new test that could give patients results in as fast as 10 to 15 minutes, helping to pinpoint the rapid spread of this outbreak. 50,000 tests a day are expected to be delivered as soon as next week. The agency is also expediting the use of an experimental new treatment that uses the blood plasma from recovered coronavirus patients to treat those who are seriously ill.
As we've been reporting, New York City has become the epicenter of this outbreak. We want to bring in Saira Madad. She is the Senior Director for the System-Wide Special Pathogens Program for New York City Health and Hospitals. She's been working for years to prepare that city for a health emergency. She's also featured in the Netflix documentary Pandemic, where she predicted something like this could be in our future.
Another thing with these so-called predictions, if there was foreknowledge that this was going to take place, that's not a prediction. Okay? Bill Gates, he's not predicting anything. If anything, he's behind the cause, ready, right there, ready with the so-called cure. Ready to be the guy that stands there and says, this is what we must do. We must create a vaccine.
Is that it just takes one person to start an outbreak. We're basically human incubators. We can host a number of different diseases. It's just a matter of time where the next pandemic is going to start. We just don't know where or how, but we know it will.
Saira Madad joins us right now. Saira, we appreciate your time on this day. We know that on Monday we hit the end of that 15-day window, the end of the 15 days to stop the spread that the White House is telling us about right now. Can you give us a progress report? Are we making progress? Is there a sense that we might be out of this window at some point soon?
Well, we're still very early on in this epidemic here in the state of New York, and we're obviously not alone. What's going to happen here is going to happen in major cities throughout the country just in a matter of days to weeks. And so a lot of these cities are not far behind New York City, so you're seeing what's happening in New Orleans, you're seeing what's happening.
So here's your map of your confirmed cases in the U.S., okay? Here's your different color schemes to show what is what. So New York, I guess, is the only state in the U.S. right now above 30,000 cases. It sits at 44,635. You can see down here, Florida, Georgia, Texas, Louisiana, California, Colorado, Washington, some of the northeastern states. They're between the 1,000 to 10,000 case range. And then the majority of states are between 100 to 99, and then there's several that are between 1 and 99 as well.
In Miami and other areas like Dallas. And so, we are obviously the epicenter today. Tomorrow is going to be another city. We just need to make sure our first and foremost priority is making sure that our frontline staff have the resources and equipment that they need. And it is coming in, but we just need to continue to advocate for it and get more of it, because it's not a matter of just a one-time injection. This is something that needs to continuously happen.
And following up on the question about the timeline, of course, we've heard President Trump talk about the fact that he would like to reopen at least parts of the economy by Easter Sunday. He seemed to back off of that a little bit yesterday, as our Kelly O'Donnell noted. But can you put this into perspective, Cyber? What is the risk of reopening things too quickly?
Well, if we open the economy sooner and basically back down on social distancing, what you're going to see is much higher morbidity and much higher mortality associated with coronavirus disease, and an even more taxed healthcare system. Right now, healthcare systems are being overwhelmed, not just here in the state of New York, but obviously across the nation. You're seeing more and more cases pop up. And what's going to happen is that they're going to continue to become very, very overwhelmed. So when people need to seek care, not just for coronavirus disease, but for other health alignments that are still existing in today's world, people are still having babies, people are still getting in car accidents, heart attacks, we won't be able to provide great services for everything else that's going to be coming through those doors. So we need to make sure that we are not overwhelming healthcare systems.
Syra, we know that teams, emergency responders have been preparing for a pandemic like this for years, but now we witness the scramble to try to get those supplies that they need urgently right now. How were we caught so short when it comes?
Okay, if you've been preparing for a possible pandemic for years, if you were preparing for years, how come you could not have had this equipment that would be necessary? You know? If you were preparing, right? They said they were preparing for years. Then you should at the very least, had equipment ready.
Comes to tests and PPE, personal protective equipment, and all the items that those first responders, nurses, and doctors need right now.
Well, at the end of the day, we rely on a just-in-time, supply chain when it comes to healthcare services. We don't keep a surplus of 4 or 5 months of personal protective equipment or equipment and supplies. You have enough resources that you need for a given time period, and it makes sense because obviously you don't want to waste resources if you don't need it. So it's a just-in-time economy and supply chain that we work towards. And so when instances like this happen, it's hard to predict how aggressive they're going to be or what their impact is. And so by the time you want to order more supplies, you have what you call even hoarding, not just shortages, but hoarding of equipment and supplies happening around the nation. And this is not something new. We saw this in H1N1. We saw this in Ebola, where people are ordering more than they need. And so those folks that actually need it, it's a backlog.
Okay, so then if you had that much time to prepare, understanding something like this could potentially happen in the not so distant future or at any point, then you should have had what would have been necessary for this type of situation. Why would you not have it? Is it part of the design, the plan, to have many people suffer?
Syra Madad, we appreciate your expertise and your time this morning. Stay safe and healthy. Thank you.
Now, as we mentioned earlier, police officers nationwide are putting their lives on the line, as they always do. But this time, it's to make sure people obey government orders to stay home and to keep at a distance. Police officers nationwide are putting their lives on the line, as they always do. But this time, it's to make sure people obey government orders to stay home and to keep.
So, police are so-called putting their lives on the line by interfering with the lives of others, mandating that they must stay home by order of their government. That's not good, people. It's not good to have a group of people with an extra given power over others to allow them to enforce the will of another. Okay?
At a distance while they're outside. NBC's Kathy Park is in Studio 1A with that part of our coverage. Kathy, good morning to you.
Kristen, good morning. As we continue to stay apart to help slow the spread of the virus, officers are patrolling the streets to enforce social distancing. It appears a crackdown is working in some places, but the message isn't getting through to everyone. These days, officers from California to New York are on the front lines keeping you safe by making sure you're keeping your distance.
But they have been enforcing it, totally have.
That means breaking up large gatherings, crammed parks, and even monitoring businesses with growing lines.
There is no congregating allowed.
A ramped up response after crowds were seen defying federal health guidelines.
Police state, that's what we're living in.
In New York City, the epicenter of the outbreak in the U.S., people are searching for relief from the indoors, heading outside for fresh air or some exercise.
So they're telling you what you're allowed to do with your own body. Okay? No one's being forced to be amongst others against their will. But if they choose to, that's their choice. Let's continue.
But reminded to play it safe.
I think people are pretty good at keeping their distance from each other. Everybody
This
has
is the
the same
mindset
goal
that
in
they're
mind
pushing.
to not spread it.
Being hard for police
Mayors across
presence.
the country giving
All right?
police the
We're
lead
gonna
on
cut it
enforcing
here.
the
Just wanted to
rules,
show you guys that.
even if that means
Catch
patrolling
y'all
from
next time.
hundreds of feet in the air.
Take it easy.
That if we